Welcome to today's class. We will be proceeding with our studies on epidemiology and research methods. So we are continuing from where we stopped last week. So today we be talking about we're going to specifics as regards to the study trials we've been looking at. So we'll be looking at randomized trial. We're going to look at what are the different types of research protocols. So first and foremost, we've already analyzed the case control study, the advantages and the disadvantages. We did this last week. So now the types of analytical studies, we have the cohort study, which is like a follow-up study. It's a follow-up study to a previous study that has already been done. And in that's this type of study, the group of subjects are chosen on basis of having been exposed to a factor. Okay. So if they're exposed to a factor that we are looking at, is one of the bases of choosing the group of people that are used in the study. Then groups are followed up to identify those who develop the disease or the outcome. So what we mean is this. Currently, let's use what's happening in the world. We have a coronavirus, currently the pandemic. So what we're saying in essence is this. You look at the number of people that have been exposed to this virus, and then look at who are those that will develop the disease or the viral outcome. So with that, you can now do your measurements. Okay, so that is the cohort study. So we proceed further. Sorry, just a minute. So we want to look at the different types of study. Sorry, the system is hanging. Sorry for that. Okay. So in cohort studies, follow up and prospective study. It's a follow up study and it's a prospective study. Okay. So what's the use of a cohort study? One is used to take prognosis factors. Is also used to directly measure the risk of development of the disease of the outcome. So when you look at the disease, you use a cohort study to look at the risk of developing the disease, the risk of coming down with that disease outcome. Another reason for that, where we do this study, is to have a more definitive information about the disease etiology. So etiology talks about the disease cause. Okay, the cause, the pattern, the progression of the disease. So this study helps us to evaluate the etiology of the particular disease. Again, this study also helps us to prepare for study of rare exposure. So when you look at rare exposure, common exposure, not just a regular exposure, something that is a little bit uncommon, you use this cohort study to evaluate such exposures. So we go forward. We look at breaking down of cohort study. So when you look at a healthy population, when there is exposure, you look at those that are exposed, look at those that are not exposed. Then in your follow-up, you're going to look at those that are exposed that are coming down with the disease. And you evaluate it with those that are exposed that are not coming down with the disease. Then you evaluate it with those that are not exposed, but they have the disease, as against those that are not exposed, but do not have the disease. So in cohort studies, you look at the analysis, you assess the strength of an association between an exposure at the outcome, then at the end of the day, use it to compute the relative risk or risk ratio. So what's the relative risk? So it's talking about the proportion of subject with the disease or the outcome among the exposed. So you are going to look at, okay, 500 people were exposed. This is, you're going to evaluate the proportion of the people that come down with the disease among those 500 that are exposed. Okay, you're going to compare it with the proportion of those with the disease among the unexposed. So you're going to bring people, expose them to an outcome, then you're going to evaluate the percentage of them that come down with the event, the disease, among those that are exposed. You're going to compare it vis-a-vis the percentage of those that come down with the outcome among those that are not exposed. So we're going to go further on this. So we're going to look at what are the advantages of a cohort study. One important thing a cohort study does is it provide direct estimate of risk. So a cohort study will help you analyze and say, okay, man, the risk to this disease is so percentage among so population. So it helps you to estimate the direct, give you the direct estimate of risk. Again, time sequence can be also ascertained. You can assess the time sequence. Cohort study is less biased of recall and observation. A study can be impacted by bias. What do we mean by bias? There can be um, individual interference to a study. So you can look at a study and you see people people influencing the outcome of a study. So let's say the outcome of a study is supposed to be ABC, but somebody is adding D to it. So you can see that people can impact, this is human beings that are doing the study. If it's not controlled, if there are no regulations, they can make their own um, sentimental input. Let's give an example. Probably somebody is working in a product he wants to use, okay, to treat a disease condition, and he has that product he wants to sell. Then you give him an opportunity to do a trial to see if that disease condition is prevalent in a place. It's likely that the person may see a way of interrupting with the normal clinical trial to influence the outcome so that they can say, oh, this disease is more prevalent. Then the person can now use his product as one of the control, and they'll see that, oh, this person's product worked well. Then it may influence a buying decision. So, but in cohort study, there is less bias as compared to some other clinical studies. So let's go further. Control, easier to assemble. So it's easier to have a control. Every study you should have a control. You use the control to measure the impact of the study. After the study, you have to look at the control. Okay, study, this is the outcome of the study, this is the outcome of the control. You can now say, oh, this analysis is right. But if you do a study and you don't have a control, someone can claim, which can be true, that that study, the impact of the study was as a result of environmental condition or changes in the climate. So it's always important to have a study when you are doing a control, when you are doing clinical trial. What is the control? The control means those group of people that did not take the active product. But as we said earlier on, when you are doing a clinical trial, the age, the demography, the sex, and the other things, conditions about the subject should also be the same thing with the control, so that whatever outcome you get, you can extrapolate it. What we mean by extrapolating is when you get an outcome in A who did not take the product, and you have an outcome in B who took the product, you can say actually is the product that is producing the result you expected. Okay, so there should always be a control in any clinical trial. And as we say, with cohort study, control is easier to assemble. Variation in exposure can be followed up. So if there's variation in exposure, you can follow it up. Then unsuspected effect of the exposure may be observed. So in cohort study, if there is an effect of the exposure, something that was not anticipated, you can easily observe it. And when you observe it, you can easily make a decision based on that. Okay. So that's on advantage of cohort study. Let's look at the disadvantage. Are there disadvantages of cohort study? Let's look at that. So what are the disadvantages of cohort study? One of the disadvantages of cohort study is that it's more expensive. It's an expensive study. Then again, follow-up period may be long. So you may have long follow-up period. And what is the impact of having long follow-up period? Definitely the cost. Because if you are following up for long period of time, it will impact on the cost. Then again, there is also a high dropout rate. A lot of people can decide not to continue with the trial. Okay, so it's different from randomized trial. In this kind of trial, the cohort study, you may start with 1,000. At the end of the day, people have dropped and so they are no longer interested in continuing with the study. Then you need a large sample size, large number. So what we mean by sample size is what is the number of people that are participating in that trial, that sample size. So a clinical trial where you have 18,000 people participating in that trial, you can say that that trial has a bigger sample size as compared to another trial where you have maybe 200. Okay, so change in exposure rate over long period of time. So there can be changes in the exposure rate over a long period of time. So let's look at once again to remind ourselves that in epidemiology study, we have quantitative study, we have qualitative study. So in quantitative study, we are talking about observational experiment, what you can observe. In qualitative study, we are looking at phenomenology, phenomenal, ethnography, we are looking at culture, we are looking at people, qualitative studies. So let's look at types of qualitative studies. We have two main types of qualitative studies. We have observational studies. Okay, so in observational studies, the researcher does not intervene. Okay, you have cross-sectional study. Cross-sectional study can be descriptive. We can have retrospective, which is case control. We have prospective, which is cohort. Then there is experimental studies. In experimental study, we have researcher intervene. Okay, so in observational study, researcher not intervene. So researcher is just observing. In experimental study, researcher will intervene. Researcher may add something. Researcher may adjust something. So in observational study, researcher is just looking out. What's the blood pressure? What's the blood flow count? What is this? What is that? Just observing and taking notes. But in experimental, researcher can add this molecule, remove this molecule, increase the temperature, adjust on this. So that's the difference. Okay. So exposure status is assigned. So it's an intervention study. So experimental intervention studies. Okay, these studies different. There are three different ways to classify them. One is based on population study. You are looking at the population. What is the number of people that were participating in this study? So example of this is Clinical trial, when you are doing a clinical trial, you want to find out about a drug. Does this drug work as claimed? Okay. Then number two, and in clinical trial, it should be a clinical setting. Clinical trial is not done on the field. Then you have field trial. If you try, you are doing it on healthy people, people that are already healthy. So a clinical trial, every clinical trial, most times, because we want to determine a therapeutic course of action, in clinical trial, you both use healthy people and people that have the disease condition you are looking at. Okay, but in the case of field trial, you have healthy people in the field. There's community trial where you are looking at a community as a whole. So a community trial, you look at all the people in the community are in community trial. Okay. So you can also look at it based on design. What is your research design? What design are you using? So there can be uncontrolled trial, so no control, self-control, or cross-control. So there's no control, or there's self-control or cross-control, but it's not fully controlled trial. Then you can have non-randomized control. In non-randomized control, allocation not randomized. Then you have a randomized control. That means allocation is randomized. So you say you put different groups. Okay, we are randomizing. We are putting this. We are giving this. We are giving that to the group. So so we go further to take time to evaluate more of these. So the third one in experimental study, another important thing you need to know is randomization. Okay, so okay, randomization is one thing you need to know. Okay, so randomization means random allocation of study subjects. So you have study subjects, you randomly allocate them into what? Treatment group and control group. The important things to know in randomization is outcome slash the endpoint. What are you looking at? You want to achieve with that trial? Do you want there can be an improvement, which is the desired effect that we are looking at, and there can be a side effect. Then it must be exactly defined. Our end goal must be exactly defined. Then measured comparably in all studies group. Okay, so the outcome must be measured. The end goal must be defined. The improvement must be defined and must be calculated. There are times, usually when you start a trial, you define this is what I want to achieve. But there are times that a trial may go the other way. Okay, there are times a trial goes the other way. You begin to see what we are not looking out for. In the case of side effect and the other thing, that also has to be documented. Then we look at blinding. What is blinding? When we talk about this trial, yes, there was a blind trial. What is blinding? Blinding means that you deny information on treatment and control status. So if you want to do a blind trial, okay, which is normally used, if you want to do quality trial, it must be a blind trial. In blind trial, the people that are administering the drug don't know what they are giving. Are you getting it? They are blind to what you are testing. They are blind to what you are given. All they just need to do is they bring the patients, they evaluate the patients, they give the product you say they should give. The product can be labeled A and B. A, and they will be the same color, they will be the same weight. So the person giving it don't know what is given. So with controlled blind trial, the likelihood of the doctor or the pharmacist or the nurse or the epidemiologist that is managing the trial, the likelihood of they affecting the result is highly limited. Why? Because they don't know what they are giving. They don't even know what outcome to expect. So they just give, and they measure the blood pressure, they measure, you just tell them this, measure measure that, then give the result. But they don't know what you're looking out for. Okay. So a blind trial is a trial where the subject or the experimenting team do not know what to expect. So it can be single, which is subject, placebo effect. Placebo is any agent that do not have clinical impact but is used in a clinical trial. Okay, so in a single blind trial means that only the subject, the person you are giving that in, doesn't know what you are giving. In double trial, the person you are giving and the person that is giving doesn't know what you are giving. In triple trial, the person that is given, the person that is given to, and the statisticians that are analyzing it doesn't know what they are given. So these are the different types of trials that you have. So let's just look at one of the clinical trial, randomized control trial. Let's just do a overview. So you have a defined population. So you select subject from a defined population. Let's say if you want to do this trial in Nigeria, okay, so you have 200 million Nigerians. So what you do, you select the number of people you want to do this trial with in Nigeria. And when you are selecting, you are going to look at similar features. So you are going to look at the people that are going to be part of those trials. They have to have similar features. You have to look at inclusion and exclusion criteria. What do we mean by inclusion criteria and exclusion criteria? What we mean is this. We are going to say that for this trial, exclusion criteria may be anybody age 0 to 18 will not participate. That's exclusion. Inclusion criteria may be anybody that weighs 80 kg and above will participate. So you are seeing inclusion criteria and exclusion criteria. They simply means, inclusion criteria simply means what are we to use to make somebody to be part of that trial. Exclusion criteria means what data we are looking at, where when we see it, we say this person will not be part of this clinical trial. So when you have selected the people you are going to be part of the trial, the next thing you need to do is to allocate subjects. Okay, so you allocate the subjects. Okay, so now under intervention, you have new treatment, current treatment, or no treatment. So when you allocate subject, let me give an example. So you want to check a new drug for malaria. I want to do a clinical trial. So let's call that new drug KY. Then you'll be using KY against current treatment, let's say Coatem, or against no treatment. Let's say you just give the person starch, normal starch. What we do is you make starch as if it's a tablet. The person will swallow it. One group will be swallowing only starch. The other group will be swallowing KY. The people swallowing only starch may even think that they are taking a real drug. Okay, so you can either say I'm testing KY against Fansida, or I'm testing KY against nothing. That's starch. Okay, so that's what we mean by new treatment, which is KY, against current treatment, which is Fansida, or against starch, which doesn't have a clinical impact. Okay, but you are just using it as a control. Then under your outcome, you are going to look at, do they improve? Those people that have malaria, do they improve? And did the protozoa reduce the malaria parasite in their bloodstream? reduce. If you want to test for malaria, at the beginning, you take a blood and check this is the quantity of malaria parasite, both in the control and in the treatment group. Then you administer KY. Then you administer the other one. At the end of the day, you are going to check the fever reduce in the people that are taking KY more than the people that are taking starch or taking your fancider. Did fever reduce? Did the malaria parasite reduce? Did headache reduce? At the end of the day, you can say, okay, we can now conclude scientifically that KY is a good anti-malaria drug based on so details. That's what you do before regulatory agencies can approve that drug. So after that, you look at data collection. The same thing you check of the people that are under current treatment or no treatment. You look at, did it improve or did it not improve? Then you collect data, mask the data. Masking is talk about blinding so that people will not know, so that they will not interfere with the results. Okay. So let's continue. Randomized control trial. What's special about randomized control trial? Because see, most clinical trial we use now in the clinical research is mainly randomized control. Okay. So why do we use that trial? What is the relevance? It's used to evaluate new forms of therapy and prevention. If you are bringing a new drug in the market, this is a trial you have to use. Is used also to evaluate treatment of drug. It's also used to evaluate healthcare technology. So if you have a device, a new device you want to use to check something, you use it to evaluate it. It's also used to evaluate methods of primary prevention, screening. It's also used in organizing and delivering health services. That's why you talk about community trial. It's also used to make impact of new policies in healthcare and healthcare financing, community trial. So when there's a new policy, okay, when there's a new policy on ground, it's used to evaluate that new policy to find out what is the impact of that new policy. Is this policy delivering what we want it to deliver? Okay, that is one of the things that we also use to look at the randomized clinical trial. That's one of the importance. So let's move to the next. So we look at the advantage of randomized clinical trial, the strongest design. It has a fantastic design. So it has a randomization, minimal selection bias. So it's more difficult for bias to interfere. That means it's more difficult for people to make their adjust the results because it's mostly blinded. Okay, there must be ethical. It must be ethical. There should be no harmful intervention. Okay, no poor clinical outcome. Okay, so what is the disadvantage? Most things that have advantage have disadvantage. Difficult for intervention in rare disease and rare outcomes. So when there's a rare disease means a disease that is not common, something very uncommon. Things like there are very diseases, some honking syndrome are not common, some kind of skin condition are not common, some allergies are not common. Like I know somebody that doesn't take beans. Anything protein that enters her mouth, her body will be swollen. It will be like somebody you put inside fire. That rare condition is not common. So it's difficult to use randomized clinical trial in rare disease because there are lesser people and these people are spread across the world. Are you going to gather them in a single place? Do you get it? and all those things. Participation of subject is crucial. So subject participation is crucial. You must make sure the subject understand and they participate. They must not go contrary to the study design. Non-compliance. People who complain are very different from those who are not. Dropouts. Another disadvantage is what? A lot of people may not adhere to experimental regimen. Okay. So what do we mean? You may say take this drug one in the morning, one at night. The people may not adhere. What do they have to lose? Sometimes, what do they have to lose? Especially the control team. There can be loss of follow-up. The person can relocate to another place, and if he relocate to another place, or they steal his phone number and he changes his phone, how can you assess? How can you follow up with that patient? Or the patient may have financial issue. He will not be coming to the hospital again for review. Drop in, non-adherence to control mechanism, compliance, so it needs monitoring, and finally, it is most costly. Okay. So thank you for attending today's class. I want to take any question. If you have a question, I want to take the question now. Any question? Do we have any question? This organizer, can we give the students access to ask questions? Any question, any comment, any contribution? This is the time for interaction. I need feedback from those, yeah, the background, those that are attending the class. I need to hear from you. Any question? Do we have any question from anybody? So in the answers of any question, let me just continue. I have 2 more minutes. So so let me just give you a schematic view. So this parallel, this A, B, crossover, now washout. There's something you call washout period. Washout period means a period where the people are no longer taking the drug. Okay, it's called washout period. Okay, so that the effect of the drug can wash out of the person's body. So unplanned, you have randomized. Under the randomized trial, you have the surgical, you have medical. So randomized trial can be a surgical trial, can be a medical trial. Okay. So you can see patient can refuse the surgery, medical can require the surgery, or vice versa. So let's just look at the classification of study design. Question: did investigator assign exposure? Okay, if it's experimental, it's yes. If it's observational, is no. Was there random allocation? Was there a comparison group? So you're going to answer this question here. So for experimental study, yes, there's always randomized control trial. But In a comparison group, you can have an analytical study. Okay, so this is the direction the trial comes. Then you go further to have either of these three studies. Okay, can either be a cohort study, can be a case control study, or it can be a cross-sectional study. So let's round up on these types of study design. So there are 7 types of study design. One is randomized control trial, one is cohort study, the other is case control study, the other one is cross-sectional study. We have case report or case series study. We have experimental animal study. Then we have qualitative research. So these are the types of studies. So in our next class, we are now going to spend time analyzing randomized control trial from introduction to application to phase 1 study, phase 2, phase 3, phase 4, the design and code, the protocols. So these are the things we are going to look at in our next class. So our time is up. Thank you for attending. God bless and keep safe. Bye-bye. So expecting us in our next class. The time for this class is up. Thank you everybody for attending.